So, when we talk about psychopathy, we're really arguably talking about this construct that Robert Hare made very robust and famous in humans that appear to be manipulative, callous, lacking any sense of guilt at hurting others, no remorse. And when you watched videos, I remember when I used to work in the lab, you'd see prisoners with this crocodile stare where they'd be looking at the interviewer like a piece of meat to be manipulated and used to their advantage. Sociopathy, on the other hand, seems to often be a more colloquial term that has slowly made its way into some clinical conversations I've seen, but certain researchers used to argue it shouldn't even exist as a term anymore, that it's sort of a loose term without clear definition. Often these days it's used to refer to someone with, say, antisocial personality disorder, which is often related to and has similarities to psychopathy, but is different. And that comes back to this discussion about change and treatment, because individuals with personality disorders, right, what the DSM-4 used to refer to as axis 2, used to be considered untreatable. And yet, researchers like Otto Kernberg in Germany, for example, developed treatment protocols that worked by appreciating that rather than looking at the person as evil, which is how we'd often describe someone with a personality disorder diagnosis, we instead consider them as having a different way of approaching the world that is more black and white. And the treatments, whether it's something like transference focused psychotherapy or, say, dialectical behavior therapy, that we're really teaching, I argue, shades of gray. We're teaching the person to look at what's happening as having more nuance, where, like a dialectic, you can have two things that appear to be opposite both be true at the same time. That the person I'm talking to might have hurt me, but that doesn't mean they are the devil. They are a person with good and bad traits that did something I did not like. That's the shade of gray. And when individuals are able to start to integrate those things, then they start to feel better because they start to understand the world in that more nuanced fashion. So this is a very complex topic. I don't want to continue talking too much here and prattling on, but as an intro, I hope that helps answer your question as well as some of the comments that followed. Thanks as always.